Well, first of all, thank you so much for having me. I really appreciate you having me on today. The origin story of my medical career, if you asked my grandmother, when did I decide I wanted to go to medical school? She probably would have said the day he was born. So it was kind of an arranged marriage, I guess, that I always was going to end up becoming a physician, but I didn't really know exactly what type. And I had these really unique opportunity when I was a teenager to observe surgery. And remember, this is back in the 1980s. So we didn't have YouTube, we didn't have Snapchat, we didn't have even Discovery Channel was I don't think was around. So I really didn't know what surgery was or what it entailed. And a close friend of the family invited me to watch him operate. I didn't even know really what kind of a surgeon he was. And so with a little investigation, it turns out he was a pretty prominent plastic surgeon in New York City. And so he gave me my first taste of being in an OR. And he said, "Hey, stand here, don't touch anything blue. And if anybody asks, tell them you're a medical student." And they don't know anything either. So that's kind of how I got introduced to the sights and the smells of surgery. And then, of course, in his office and meeting his patients and seeing how their lives were changed from their cosmetic procedures and reconstructive procedures, I really felt like this was something I wanted to pursue. But again, I wasn't 100% sure. I kind of just felt my way through medical school eventually. And then I did my internship and residency in general surgery. But I did have the opportunity to stay connected to that mentor of mine for many, many years. And I worked very closely and shadowed him. And it was really one of his patients that introduced me to hair transplants, because as a general surgeon interested in plastic surgery, really didn't see any hair transplant procedures. I didn't know what it entailed. I thought they were all just kind of pluggy and painful and like, why would anyone bother with that? That type of thing. And that was pretty much the prevailing information that everybody had, even as a physician back in the early 1990s. And this patient really opened my eyes to really what a hair transplant could be. And so he was coming in for something else. And I was doing my due diligence, as a good intern or resident, taking a detailed medical history. And he said he had a hair transplant. And I'm looking, trying to figure out where on his head did he have the transplant? Because it certainly looked natural to me. And so the conversation went like this, well, can you tell me like where you had your hair transplanted? And he said, "Oh, up in Toronto." And I said, "Well, that's kind of interesting. Here we are in New York and you had it up there." But I was actually asking about, where on your head you had it done. And so we laughed about it. And, he told me the story about how he sought out this surgeon who was doing single follicle implantation, really the state of the art microscopic types of procedures, which was pretty new at that time. And his results looked amazing. And I was just fascinated by his layperson's description of the transplant procedure, this labor intensive labor of love, if you will, and the artistry that was involved and how great the results looked. Of course, he was so stoked that I couldn't tell that he had had a hair transplant. So he was pretty elated about that. But really what stuck in my mind about that conversation, and the conversation was probably only about maybe 20 minutes, 15 minutes long, perhaps, was how he described it changed his life. And so he told me about socially, professionally, how his attitude completely changed, how he stepped into a new career, a new relationship, and his life totally looked different, he told me, after the transplant had grown in. And that kind of stuck with me because here I was in a path towards plastic and reconstructive procedures. And I've been studying and shadowing my first mentor on that. And I really hadn't thought anything about hair transplants at all, much less know about how they were done. So that kind of was the spark in a little kindling there that kind of started the fire, as we would say, and started my journey to investigate it a little bit further and so forth. And so there were a lot of other steps and stages, obviously, to learn about the procedure and what it was, what it entailed, to get training, to find another mentor, a physician who would actually teach me and train me and brought me into his practice many years later. To kind of finish off, that's where I really learned how to do hair transplants. And I decided to take time off of my residency and internship to do that. And honestly, never looked back. I just went straight into hair transplants after that. So after a year of fellowship training and mentorship from a hair transplant surgeon out on Long Island, I decided to move to Florida with my wife. We were engaged at the time, and to start the practice. really with no knowledge about how to start a business at all, to be honest. But that's a whole nother story.
Definitely a
We
different
came,
story.
yeah, but that's kind of how I got my start. Really seeing how cosmetic procedures and especially the hair changed someone's life, and that's really how I kind of built the practice, thinking about how I was going to change these patients' lives, really one person at a time.